Welcome to PlacidWay Pulse, your guide to exploring trusted healthcare, wellness, and medical tourism opportunities around the world. Today, we're diving into one of the fastest growing conversations in global wellness and medical tourism: stem cells for longevity. Across the United States, more people are exploring therapies aimed at supporting healthy aging, recovery, energy, mobility, and overall wellness. But with high treatment costs, limited accessibility, and growing interest in alternative healthcare experiences, many patients are now traveling internationally to learn more about stem cell therapies and longevity focused wellness programs. From Mexico and Thailand to Panama, Colombia, and beyond, international clinics are attracting patients who are searching for personalized wellness experiences, advanced regenerative medicine options, and recovery focused environments outside the traditional healthcare system. And I have to say, when we look at the source material for this deep dive, it's just wild. We are essentially looking at a reality right now where everyday people are, taking their biological agency back.
Yeah, they really are. It's a massive cultural shift. I mean, the whole paradigm of aging is this inevitable, just a unidirectional downward slope. That's fundamentally breaking down in the public consciousness right now.
Right, because I feel like a decade ago, the protocols we were analyzing today were, they were totally locked behind closed doors, right? Like exclusive retreats for tech founders or, professional athletes.
Yeah, it was a millionaire health regimen. You had to have the capital to spend hundreds of thousands of dollars on cellular optimization. But globalized healthcare travel has essentially shattered that exclusivity.
Yeah.
The barriers to entry have just completely fallen.
Which opens up this whole new world for the rest of us. And I want to focus on that idea of aging because historically the medical model most of us grew up with is so focused on lifespan. Like it's just a game of addition, right? Keep the heart beating, add another year to the calendar. But the sources highlight this huge shift toward health span.
Yeah, and those are two entirely different philosophies of medicine. I mean, lifespan is purely chronological. It just measures the duration of your existence. Health span, though, that measures the duration of your vitality.
Right. It's the years you spend actually feeling good.
Exactly. It is the portion of your life spent completely unburdened by chronic disease or that deep systemic fatigue we just casually write off as, getting old, and the structural degradations like severe joint inflammation.
Because what's the point of extending your life by a decade if that whole decade is spent in a wheelchair or, dealing with severe pain?
Precisely. The goal of longevity therapies isn't immortality. The objective is to compress morbidity. You want the period of physical decline at the very end of life to be as short as biologically possible while you maintain peak cognitive and physical function for as long as you can.
It's the difference between merely existing and actually participating in your own life. And achieving that means we have to step away from what I always call Band-Aid medicine.
The reactive model, yeah.
Yeah, like if you think about a crumbling brick wall, traditional medicine is often just slapping a fresh coat of paint over the cracks, You take ibuprofen every single morning to mask the pain in your shoulder so you can play golf. Or you prescribe a statin to lower a number on a chart.
Right. The paint looks fresh for a day, but the mortar underneath is still turning to dust.
Exactly. So what is the actual mortar in our biology? Because conventional medicine seems terribly equipped to address the root cause of why we age.
Well, the crumbling mortar in your analogy is cellular degradation. To understand why people are getting on planes for regenerative therapies, we have to look mechanistically at what aging actually is. It's not just the passage of time. Aging is it's an accumulation of cellular damage.
So it's like our internal repair crew is just getting tired.
That is a great way to put it. Throughout your life, your body relies on a native population of stem cells. They are the body's primary mechanism for maintenance and repair. If you tear a muscle at age 20, this workforce mobilizes instantly, right? They differentiate into the necessary tissue types. They fix the micro tears.
But as we get older, that workforce, what, it just retires?
Basically, yes. The biological crisis of aging is that this native workforce eventually depletes. They decrease in sheer numbers, and their functional capacity drops. They show up to the job site exhausted, without their tools.
But the wear and tear doesn't stop. You keep walking, you keep dealing with environmental stress. And this brings us to a concept in the sources that I found absolutely fascinating: inflammaging.
Inflammaging is arguably the central biological mechanism of the aging process. It is a state of chronic, low-grade, systemic inflammation. It just simmers quietly in the background of your biology.
And the sources point to these things called senescent cells as the main culprits, right? The zombie cells.
Yes, the zombie cells. So normal cells have a life cycle. They divide a certain number of times, and when their DNA gets too damaged, they undergo a programmed cell death. It's called apoptosis, and then the immune system clears them away.
A nice, clean biological recycling program.
Exactly. But senescent cells evade that program death. They suffer critical damage, they stop dividing, and they stop doing their actual job, but they refuse to die.
They just sit there taking up biological real estate without paying rent. But it's worse than just being lazy, isn't it? Because they actively poison the area around them.
That is the critical issue. They secrete this highly toxic cocktail of inflammatory cytokines. A single senescent cell can essentially corrupt the healthy cells neighboring it. It triggers this cascade of inflammation that degrades tissue, stiffens blood vessels, and basically creates the physiological environment for almost every age-related disease.
Wow. From osteoarthritis to neurodegeneration, it all starts with this zombie cell inflammation.
Exactly. And this is where mesenchymal stem cells, or MSCs, enter the picture. The objective of longevity therapy isn't just dumping new cells into the body to magically become new cartilage. Their primary function initially is immunomodulation.
So they act like biological general contractors. I want to really unpack how that works because people throw around the term stem cell therapy like it's a magic potion, but the sources describe this paracrine effect, which is fascinating.
The paracrine effect is everything.
Right. So if I'm understanding this, the introduced stem cells aren't just physically turning into the missing tissue, they are communicating. I sort of picture it like a massive Wi-Fi software update for your biology.
The Wi-Fi analogy is incredibly accurate. MSCs secrete a really complex array of signaling molecules and anti-inflammatory proteins into your body. They actually detect the chemical distress signals emitted by the inflammation, the noise made by the zombie cells.
And then they just migrate straight to the damage.
Yes, they home in on those specific sites. And once there, they broadcast their paracrine signals. This biological software update essentially instructs your hyperactive immune cells to stand down. It stimulates your own dormant native stem cells to wake up and start repairing tissue.
They change the chemical environment from degradation to repair, which completely explains the rise of this biohacking culture we're seeing. If you realize aging is just a communication breakdown, you don't view physical decline as fate anymore.
You view it as an engineering problem.
Exactly. People are looking at the data and deciding, I'm not going to wait until my knee is bone on bone or my brain fog is unmanageable. I'm intervening now. But here is where the friction comes in for a lot of people listening.
The regulatory side.
Right. Because if this paracrine effect is so powerful, why the international flights? Like, if I have the budget, why can't I just drive down to a clinic in, say, Ohio or California and get this ultimate software update today? The sources mention an efficacy gap. What is the actual barrier in the U.S.?
The barrier is strictly regulatory, and it creates a profound biological limitation. In the United States, the FDA governs human cells under very specific frameworks. For a domestic clinic to offer an autologous stem cell treatment, which means they take your own cells from your fat or bone marrow and give them back to you, they have to adhere to the minimal manipulation rule.
Let's define minimal manipulation for the listener because it sounds bureaucratic, but it physically dictates the medicine you get.
Under this rule, a U.S. doctor can extract your tissue, put it in a centrifuge to separate the cells, and maybe wash them. But they cannot legally alter the biological characteristics of those cells. Most importantly, they are completely prohibited from placing those cells into a culture flask to multiply them over time.
So the entire process from extraction to reinjection has to happen in a single surgical sitting.
Exactly. The FDA views culturing cells outside the body as manufacturing a new biological drug, which requires a billion-dollar clinical trial process.
Okay, so because of that rule, a doctor in the U.S. pulls out whatever is currently in your fat, spins it around, and gives it back. But the problem is obvious, right? If I am 60 years old, the cells you are pulling out of me are also 60 years old.
They are exhausted.
Yeah, they're the tired workforce. And more importantly, there just aren't very many of them in that sample.
Right. The yield is the critical failing point domestically. A same-day, uncultured extraction might yield a mixture containing maybe 1 million to 5 million viable stem cells. In the context of an adult human body, that number is almost negligible.
But then you look at places like Mexico, Colombia, or Japan.
Yes, those nations have established progressive, distinct legal pathways for regenerative medicine. They allow scientists to take a cellular sample into a highly sterile clean room, isolate the best cells, and give them the nutrients to divide and multiply for weeks.
This is the garden hose versus the fire truck analogy. If your body is suffering from a systemic forest fire of inflammaging, A U.S. treatment of 3 million aging cells is like showing up with a garden hose. The water is good, but the volume is totally insufficient.
Exactly. By traveling abroad to an advanced lab, you access the ability to culture populations of 100 million or even 300 million highly active cells. You are bringing in the entire fleet of fire trucks.
Without that massive volume, the Wi-Fi update just isn't loud enough to override the noise of the zombie cells. But the FDA rules are only one side of the coin, right? We have to talk about the financial
The
reality.
economics are staggering.
Yeah, because if you want any sort of advanced cellular protocol in the US, your insurance company is going to classify it as experimental or elective wellness. They won't cover a dime. You're looking at out-of-pocket costs that can decimate savings. I mean, $25,000 to over $50,000 easily.
The financial arbitrage of international travel is impossible to ignore. The overhead costs for labs and medical facilities are drastically lower in Latin America or Southeast Asia, and those savings get passed directly to the patient.
So what are we actually talking about cost-wise abroad?
A premium, highly concentrated cultured stem cell protocol in a top-tier hub like Cabo San Lucas or Bogota might range between $4,500 and $8,000.
Wow. So you can book first-class airfare, stay in a luxury oceanfront resort for a week, get 50 times the cellular volume you'd get at home, and still save, what, 60 to 80%?
Easily. But it's not just about getting more cells for less money, it's about the type of cells.
Yeah.
A massive draw for patients is allogeneic therapies, specifically Wharton's jelly.
Right, because this bypasses the problem of using an older patient's tired stem cells completely. Allogeneic means donor material, correct?
Exactly. The gold standard in longevity right now is ethically sourced, donated umbilical cord tissue. Inside the umbilical cord is a gelatinous substance called Wharton's jelly, and it is extraordinarily rich in mesenchymal stem cells. From a biological standpoint, these are day zero cells.
Day zero meaning they haven't been subjected to 50 years of bad diet, stress, and environmental toxins.
Precisely. They are highly proliferative, meaning they replicate rapidly and they secrete a massive volume of anti-inflammatory cytokines. And critically, they are immune privileged.
Wait, immune privileged? So the body doesn't reject them as foreign invaders?
Exactly. They don't express the complex markers that trigger immune rejection. So you can introduce these vibrant day zero cells into an older adult without matching blood types or using immunosuppressive drugs. The patient's body just recognizes them as an influx of fresh repair signals.
That is incredible. And the innovation doesn't even stop there. The sources talk a lot about exosomes, which seems like the absolute bleeding edge of this science.
Exosomes are fascinating.
Yeah, if the stem cells are the general contractors shouting instructions, exosomes are like the actual blueprints being handed out, right?
That is the perfect mechanical description. For decades, we thought stem cells needed to physically engraft and become new tissue to heal you. But now we know the vast majority of their power comes from what they secrete. Exosomes are these microscopic, lipid-bound bubbles released by the stem cells.
I want to make sure you, the listener, can visualize this. The stem cell creates a tiny lipid envelope, packs it full of genetic instructions on how to stop inflammation and build cartilage, and releases it into the bloodstream.
Right, and it floats through the body until it bumps into a damaged cell. Because the exosome has that lipid outer layer, it seamlessly merges with the damaged cell's membrane and just empties those instructions inside.
It's pure biological communication. And because they are cell-free, no nucleus, no DNA, the risk of any adverse reaction is virtually zero.
Yes. Many international clinics now culture millions of Wharton's jelly stem cells in a bioreactor, harvest the billions of exosomes they produce, and give that highly concentrated liquid directly to the patient. It delivers a massive healing effect without even introducing a live cell. But the regulatory red tape around exosomes in the U.S. is immense, which is another huge driver for medical travel.
Okay, so looking at all these tools-cultured MSCs, Wharton's jelly, exosomes, who is actually packing their bags and going, because the old stereotype of medical tourism was just, people looking for a cheap cosmetic surgery. But the demographics and the sources are so diverse.
The patient base has really fractured into distinct archetypes driven by very different motivations. Take the burned-out executive, for example.
Oh, yeah, the corporate leaders flying to Tokyo or Bratislava.
Exactly. These are individuals whose lives are defined by chronic, inescapable stress. For them, time and mental acuity are their most valuable assets. They aren't looking for a spa day. They're dealing with adrenal fatigue and deep brain fog, which is literally a neuroinflammatory response to stress.
So they demand intense data. They want their blood drawn, their biomarkers analyzed at a molecular level, and a systemic exosome infusion to repair the cellular damage of 80-hour work weeks.
They view their biology the exact same way they view a corporate asset. It requires investment and maintenance to yield high performance.
And then on the flip side, you have the active adult and athlete. This group is super relatable. People in their 40s to 60s who refuse to give up tennis or skiing, but their rotator cuffs or knees are shot.
Right, their motivation is orthopedic preservation. In the U.S., the standard of care for a degraded joint is pretty brutal. Cortisone shots, which actually accelerate cartilage degradation over time, and eventually joint replacement surgery.
Where they cut out your bone and hammer in titanium, the biomechanical trauma of that is massive.
It alters your gait, requires months of painful rehab, and the prosthetic has a limited lifespan. So these active adults are traveling to progressive clinics in places like Colombia to avoid the knife entirely. They want targeted injections of cultured day zero cells straight into the joint to regenerate the tissue naturally.
Which transitions perfectly into the retiree seeking mobility. Reading the data on this group is genuinely moving. When you're 70, longevity therapy isn't about looking 25 again. It's about independence.
The psychological weight of losing your mobility is profound. For an older adult dealing with severe inflammaging, just getting out of a chair is painful. The inability to get down on the floor, to play with a grandchild, that's a huge loss of quality of life.
So they are seeking systemic protocols to quiet that storm of senescent cells, just to lower their pain baseline so they can actually enjoy retirement.
Exactly. And finally, we see the wellness-focused traveler. They understand that a sterile, fluorescent-lit hospital is a terrible place to heal. They're booking 2 weeks in a mountain retreat in Costa Rica, combining cutting-edge biology with a psychological reset of a vacation.
A medication. I love that term. To really ground all this, I think it helps to synthesize a realistic patient journey from the source data. Let's look at a persona. Let's meet David.
Okay, let's walk through David's journey.
So David is 56. He runs a logistics software company in California. On paper, his life is amazing. But physically, his engine is sputtering. He's dealing with decades of airline travel, poor sleep, and he hits a wall of brain fog every day at 2 p.m. But his biggest misery is his right knee.
The structural degradation.
Right. Tennis is his outlet, but the inflammation is so fierce he can barely play a single set. His local doctor just offers NSAIDs and says, see you in 5 years for knee replacement.
If we analyze David's internal state, there's a huge mind-body dissonance. His ambition and intellect are at maximum capacity, but his biological chassis is failing him, and that chronic pain drains his executive function at work.
But David is an analytical guy. When a friend mentions flying to Mexico for stem cells, he's immediately skeptical, right? He imagines unregulated, unsanitary offshore clinics. He's terrified of getting scammed or getting an infection.
Which is a very healthy skepticism to have.
Exactly. But the pain pushes him to read the actual clinical data. He realizes his insurance won't cover domestic treatment anyway, and domestic would only yield a few million of his own aging cells. He discovers that in Cabo, he can legally access a cultured protocol delivering 200 million Wharton's jelly cells. The logic finally overcomes the fear.
So he makes the inquiry.
But I want to know what happens next. The logistics of medical tourism sound overwhelming to me. How does he get from his laptop in California to a treatment chair in Mexico without losing his mind?
The operational logistics of top-tier clinics are specifically designed to neutralize that exact anxiety. It starts with a critical figure, the patient coordinator. The sources mention coordinators like Daniel Sands in Cali, Colombia. They act as the patient's personal advocate and logistical architect.
So David isn't fumbling with medical translations or booking random hotels. The coordinator handles the friction. And the first medical step is the remote intake, right? A lot of people assume you just fill out a web form, pay a deposit, and fly down.
A reputable clinic will never operate that way. The remote intake is a rigorous screening process. David has to securely send his recent blood panels, his medical history, and recent MRI imaging of his knee. The International Medical Board then reviews his biomarkers.
Let's clarify this. This intake is not a substitute for a real consultation. It's an exclusion process.
That is the crucial point. They are looking for contraindications. If his blood work shows an active systemic infection or an undiagnosed oncology issue, they will reject him.
Sure.
Certain cancers can interact unpredictably with growth factors. The goal is to guarantee he is a viable candidate so he doesn't waste his money traveling in vain.
Okay, so assuming his biomarkers are clean and the MRI shows he still has some cartilage left to work with, he's approved. He books the flight. And this is where his fear of the shady back alley clinic is completely shattered.
Your rival experience.
Right. He lands in Cabo, and he's not wandering around looking for a taxi. A VIP bilingual concierge meets him at baggage claim. He's taken through a medical fast-pass lane, bypassing customs bottlenecks. He's driven to a facility that feels like a luxury resort, complete with an ocean view suite.
And then the remote screening is validated with in-person diagnostics. He meets his attending physician, they physically examine the knee, assess joint mobility, and review new blood panels drawn that morning. The exact protocol is finalized.
I really want to break down the actual days of treatment because it's rarely just one quick injection. There is a whole preparation phase. The sources mention IV therapies before the stem cells. Why?
Think of it as preparing the soil before planting a highly valuable seed. They might administer specialized vitamin and mineral IVs to ensure deep cellular hydration and correct micronutrient deficiencies. They want to lower his baseline cortisol from the stress of travel.
Then comes the main event. For his knee, the doctor uses ultrasound guidance to inject cultured MSCs directly into the giant capsule. But David also has brain fog, so he gets a systemic protocol too.
And the systemic protocol is astonishingly anticlimactic. He just reclines in a lounge chair overlooking the water. An IV is placed in his arm, and over 1 to 3 hours, tens of millions of potent MSCs and exosomes are slowly infused into his bloodstream. No general anesthesia, no surgical trauma, just the biological software update.
I find the environment itself so fascinating. We touched on the luxury aspect, but there is a hardcore biological imperative behind the oceanfront suites and gourmet food, isn't there?
The autonomic nervous system plays a massive role here. If David recovers in a loud, chaotic hospital room, his body is in a state of sympathetic arousal, fight or flight. His adrenal glands are pumping cortisol, which is highly catabolic. It breaks tissue down and actively suppresses the immune system.
It creates a hostile environment for the new cells.
Exactly. High cortisol can literally prevent the stem cells from engrafting. So by putting him in a serene environment, feeding him anti-inflammatory meals, they're artificially inducing a parasympathetic state, rest and digest.
The luxury is literally a medical modality to lower cortisol. And that holistic approach extends to the bundled therapies, right? Like at the Immunotherapy Center in Tijuana. They surround the stem cells with therapies that supercharge the body's metabolism.
Yes, the adjunct therapies are critical.
Let's unpack some of those, because they sound like sci-fi, but they are grounded in deep biochemistry, like ozone autohemotherapy. If I hear ozone, I think of toxic atmospheric gas. How does mixing my blood with ozone help me heal?
It's a brilliant question. It comes down to the concept of hormesis. Hormesis is a biological phenomenon where a mild controlled stressor triggers a massive beneficial adaptive response, like how exercise tears muscle fibers so they rebuild stronger. Medical-grade ozone gas is highly reactive.
So they draw your blood and expose it to this gas.
Yes, in a sterile, closed system. The ozone instantly reacts with the cell membranes in your blood, creating lipid oxidation products. When that ozonated blood is reinfused, it acts as a profound wake-up call to your immune system. It commands your cells to drastically ramp up production of endogenous antioxidants like glutathione.
A mild shock that forces the body to build its own defense system. That is amazing. And they also use NAD plus 5e therapy. NAD is everywhere in the biohacking world right now.
NAD plus is a vital coenzyme found in every living cell. It's the fuel for your mitochondria. As we age, our NAD plus levels plummet, which is why older cells lack the energy to repair DNA. By giving high-dose 5e infusions of NAD plus alongside the stem cells, they are flooding the patient's biological power grid with fuel. The new cells need massive amounts of cellular energy to build new tissue.
Wow. And what about hyperbaric oxygen therapy, or HBOT? How does pressure and oxygen help stem cells?
Normally, oxygen is carried by hemoglobin in your red blood cells, but there's a limit to that capacity. In a hyperbaric chamber, the atmospheric pressure is increased while you breathe pure oxygen. This pressure dissolves the oxygen gas directly into your blood plasma, bypassing the red blood cells entirely.
So your plasma just becomes hyperoxygenated.
Exactly. This oxygen-rich plasma can reach areas of severe inflammation and poor circulation, like the deep cartilage in David's knee, where normal red blood cells struggle to go. It stimulates the creation of new blood vessels, giving the stem cells a structural highway to do their work.
Okay, so David's week in Cabo is this highly choreographed symphony of cellular prep, targeted delivery, and metabolic supercharging. He flies home, but a good clinic doesn't just abandon him at the airport.
The follow-up is essential. The biological integration of hundreds of millions of cells takes months. The patient coordinator schedules regular telehealth check-ins, tracks his pain scales, and guides his dietary choices to keep systemic inflammation low while the cells remodel the tissue.
We've painted a very clear picture of why this industry is exploding, but I want to pivot and apply some serious friction here. We need to look at the pros and cons. The pros are obvious. Access to advanced cultured cells, huge financial savings, holistic care. But let's be real, you are flying to a foreign country, outside the FDA's umbrella, letting someone inject cultured biological material into your veins. The risk is not zero.
The risks are very real, and they stem primarily from the profitability of the industry, which inevitably attracts bad actors.
Right, because if I Google stem cells Mexico, I get thousands of slick websites. How high is the risk of getting scammed or getting a severe infection from a bad batch of cells?
The danger isn't the science itself. It's opportunistic, subpar facilities hiding behind excellent digital marketing. A layman can't easily distinguish between a world-class laboratory verifying cell viability and a makeshift clinic in a strip mall injecting dead, contaminated tissue.
That is terrifying. Choosing the wrong clinic means risking sepsis. Navigating this requires intense due diligence. And beyond bad clinics, there's the risk of bad expectations, the fountain of youth fallacy. If I get a massive systemic protocol, am I going to wake up a month later feeling 25?
Absolutely not. And any clinic promising that is lying. Cellular therapy is not a cure for chronological aging. The clock keeps ticking, and the timeline requires immense patience. Many patients do feel a rapid energy surge and a drop in pain within the first week.
But that's just the anti-inflammatory effect of the exosomes, right?
Exactly. The actual structural regeneration, building a new collagen matrix or synthesizing new cartilage, takes real biological time. We are talking 3 to 6 months to see the final structural outcome.
People need to understand it's a slow biological rebuild, not a magic trick. And what about side effects?
Severe adverse reactions are exceptionally rare with properly screened Wharton's jelly from a certified lab, but patients should expect a natural immune response. It is highly common to experience mild fatigue, a temporary low-grade fever, or localized soreness for 24 to 48 hours post-treatment.
Which is just evidence that the immune system is actively initiating the remodeling process. It takes energy, so you feel tired.
Okay, given the risks of choosing a bad facility, we need to equip you, the listener, with a non-negotiable checklist. How do you verify a clinic is legitimate? And let's look past generic hospital accreditations, because a hospital might be great at trauma surgery, but know nothing about handling cultured stem cells. Generic accreditations are insufficient here. The first metric is national regulatory oversight. You must ensure the facility operates legally within the highest framework of its host country. In Mexico, you demand to see their current certification from COFEPRIS.
That's their equivalent of the FDA, right?
Correct. They dictate strict standards for clinical hygiene. If you are exploring Japan, it's even more rigorous. Japan operates under the Act on the Safety of Regenerative Medicine, or ASRM.
The sources mention the ASRM. They don't just inspect the building, they inspect the science.
The Japanese Ministry of Health requires any clinic to submit their specific, evidence-based medical protocols for review before they ever touch a patient. It is one of the most transparent regulatory environments in the world.
But the clinic certification is only half the battle. If the lab is producing dead or contaminated cells, the world-class doctor can't help you. Where are these cells being expanded?
The lab is the beating heart of the process. You must verify that the clinic utilizes an ISO-certified clean room. This dictates the maximum number of microscopic particles permitted in the air, ensuring a hyper-sterile environment to prevent bacterial contamination. Furthermore, the lab must adhere to good manufacturing practice, or GMP, guidelines.
What does a GMP certification actually guarantee for the patient?
It guarantees 3 things: absolute sterility, genetic stability, meaning the cells haven't mutated during expansion, and guaranteed cell viability. A GMP lab utilizes advanced tech, like flow cytometry, to physically count the number of living cells. They provide a certificate of analysis proving the vial contains exactly, say, 100 million viable MSCs.
So the ultimate metric is transparency. When you are on a consultation call, you ask the hard questions. Where do you source your umbilical cords? Can I see your certificate of analysis? Can I see your COFEPRIS certification?
And if the clinic hesitates or gives vague marketing answers, you hang up the phone, you walk away immediately.
Seriously, protect yourself. Now, as we wrap up this deep dive, I want to bring all this biology back down to the human level. Because the choice to do this is so emotional. It's about maintaining your identity. If your identity is the grandfather who hikes and your knees give out, you lose a piece of who you are. The motivation here is curiosity and optimism about what your body can repair, not just fear of getting older.
The emotional catalyst is profound.
Mm.
And the clinical data shows that the patients who experience the most transformative results are the ones who view the therapy as the initiation of a holistic lifestyle shift, not a standalone cure.
I love the hardware and software analogy. When you get this massive infusion of cultured stem cells, you just bought a state-of-the-art biological hardware upgrade. But that hardware depends entirely on the software you run every single day.
The software is your behavioral choices. The patient goes home, their pain is reduced, their energy is back. What do they do with that new baseline? Successful patients adopt anti-inflammatory nutrition to prevent reaccumulation of cellular stress. They manage their cortisol. They engage in consistent load-bearing exercise to signal the new cells to build bone and muscle.
You cannot biohack your way out of a terrible lifestyle. If you get 200 million cells and go home to eat processed food and sit on a couch under chronic stress, you're just going to rebuild the zombie cells. But combining the hardware upgrade with the right lifestyle software, the results over years are astonishing.
To synthesize the core message today, the democratization of regenerative medicine is fundamentally reshaping global healthcare. Everyday individuals are refusing to accept geographic limitations on their health span.
It's a phenomenal shift in agency, but remember, this is serious medicine. Reclaiming your vitality requires intensive due diligence and a relentless commitment to your own wellness journey. You have to do the work.
The responsibility ultimately lies with the patient to be an educated participant in their own biology.
And to leave you with a final provocative thought that really struck me in our research. Rethink the entire concept of inheritance. We usually picture leaving behind a stock portfolio or real estate. But what if the single greatest asset you can invest in is your own biological preservation? Some families are now utilizing proactive stem cell therapy in their 40s and 50s as a strategic financial decision.
It is a radical reframing of healthcare expenditure. Instead of viewing medical costs as an unavoidable drain during the final decade of life, paying for palliative care and managed decline, they are front-loading the investment.
Exactly. What if spending $10,000 on a systemic cellular reset at age 50 prevents the need for a $100,000 intervention at age 70? What if preserving your physical vitality and your cognitive sharpness so that you can actively guide your children and actually enjoy the wealth you built is the ultimate form of wealth preservation? It shifts the paradigm from a reactive cost of dying into a proactive investment in living. It is a fascinating concept to mull over. Thank you so much for joining us on this deep dive into the world of medical travel and longevity. Keep exploring the science, stay intensely curious about what your body is capable of, and remember that you have the power to take charge of your own wellness journey. Until next time.